Many people visit their dermatologist to have unwanted hair removed, but what if you want to regrow your hair instead? Dermatologist Dr. Doris says it is possible, and she joins me now with some non-surgical ways you can try to reverse hair loss. Dr. Day, great to see you again.
Thanks for having me.
So some people can get very ashamed and embarrassed when they start to lose their hair. It's a very upsetting thing to have happen to you. But there are some things you want people to remember.
There's a few main points. One is that you're really not alone. Hair loss is as common in women as it is in men. So 20%, that high, of women in their 20s, 30% in their 30s and 40s, and 50% or higher of women in their 50s and up notice hair loss. So it's a different pattern than it is in men. Also, there are some medical conditions that can be addressed that can make somewhat of a difference. And there is hope. There are things that we can do.
That is very reassuring. And it's fascinating to hear that it is as common in women as in men, because somehow I don't think that's the public perception.
And that's because it's a different pattern. Men tend to lose in the temple areas, and then it kind of creeps around the back and reaches the front. Women lose, they keep the frontal hairline, and they lose in the crown area. And there's a patterned and non-patterned loss. There's a scarring and a non-scarring pattern. So we'll stick to the non-scarring because that's the most common category, and that's what we see. And it's not just the scalp, it's also the eyebrows and eyelashes over time.
There's so many places where you want to keep your hair. Now, you say that there are lots of products out there that we can use to help us, but is it important to visit our dermatologist first?
Absolutely. It's really important to understand what the underlying cause is, because if it's a medication, if it's a stress factor or hormonal issue, all those things can be addressed. And while that may not make the hair exactly grow back, it may prevent further hair loss and may help you address the issue. So one thing I hear women say commonly is if they have a thyroid issue, they think that that's directly associated. And if they fix the thyroid, then the hair gets better. A lot of thyroid issues are autoimmune, and sometimes hair loss that's non-scarring can be autoimmune as well. So it just helps us recognize patterns, but fixing the thyroid doesn't always make the hair grow back. So your hair may be dry and brittle if your thyroid is low. It may break more easily, but it doesn't necessarily cause hair loss directly.
All right, so let's talk about some of the ways that we can help our hair regrow. Okay. Do you have any one favorite method, or do you favor a combination?
I think the most important thing is to do everything you can. So I tend to offer combination treatments that are non-surgical. So for someone who's a good surgical candidate, I send them to a dermatologist who does hair transplant treatments. But even when you do that, you need to add in the other non-surgical approaches in order to maximize hair regrowth and minimize further hair loss, because it is a progressive, ongoing kind of a condition.
Now, let's start with over-the-counter. Are there any over-the-counter things that we can buy?
Well, Rogaine or minoxidil, those are over-the-counter. There's a women's strength and a men's strength. It takes about 3 months or so to see the results. And an important thing to notice is that at about 1 month, you may notice increased shedding. That's not the time to stop using it. Stay with it, because that means your hair will be coming back.
So this actually does work?
Yeah, it does work. It's FDA approved. It has great clinical data. It does work, but not everything works for everybody. So it's one thing to try.
Right.
And I often recommend that women start with the women's strength, the 2.5%. And if after 3 to 6 months they don't see enough of an improvement, they can go up to the men's strength. Some of it is absorbed, so you may notice increased hair growth in other parts of the body that you don't want, but we can always get rid of that.
Right, exactly. That's easier to get rid of. Yeah. Now, what about prescription products? What's available there?
So prescription products for men, there's Propecia. That doesn't work as well for women, although some women have more of a male pattern hair loss, and sometimes we can prescribe it for them as well, but that's really more for men. And it does work very well, both in stopping further hair loss or minimizing further hair loss, and also in regrowing hair in a significant number of people. So not as useful for women. I use an off-label drug called aldactone, which is really a diuretic. It's a water pill used for people with high blood pressure to get rid of water, and one of the side effects is it blocks certain hormone receptors that can help hair growth. So for women, I find that to be more effective, but only for women who aren't planning pregnancy.
And I guess obviously you'd have to clear this with your doctor. Obviously it's a prescription drug anyway, but since you're looking at the side effect rather than the actual
And it takes a while to work.
Okay, keep that in mind.
Yeah.
Now, what about in-office treatments? I understand that you use the laser as well to help hair grow.
Right, so there is a hair growth laser. There's a hair comb that you can do at home, and that's fine. That is actually FDA approved, and it does have clinical data, but there's a version of it that's in office that I think is more effective, and often if you do it together, you get the best results. So it's like a hood that you sit under that has a specific wavelength of light that helps maximize the circulation and the environment for hair to regrow. So when you do that in combination with the other treatments, and sometimes even by itself, it works really well. But all these treatments need need to be ongoing. When you stop, you lose the benefits. It doesn't make it worse than it would have been, but it stops the benefits, and so you end up where you would have been without them. And it takes a few months to see the results. And I have a patient, it's really interesting what you see in patterns, but in some patients who have gray hair now, who dyed their hair blonde, the new hair is growing in dark. So not only is it new hair, but it's actually younger, healthier hair.
That's great. So if they keep it up, who knows what they'll have by the time they're 80, right?
Exactly.
So what about our eyelashes? There is something that can help us regrow our eyelashes.
Right. So Latisse is a great drug that's FDA approved for regrowing eyelashes. And I did participate in the study, so I kind of have the inside scoop on it, which is always nice. And it was incredibly well tolerated, and it worked pretty much for everybody who used it. It's very, very popular, and it's safe. I tend to recommend FDA-approved products, especially around the eyes. And this is the only product that's approved for eyelash growth. And the results were really quite remarkable in that you have longer, thicker, darker lashes.
And it is prescription only.
And it's prescription only. And one thing is, a lot of women also put it on their eyebrows, and that helps grow. So I tell them to do the Latisse on the eyebrows at night and Rogaine on the eyebrows, the 5% men's strength on a Q-tip on the eyebrows in the morning, and their eyebrows grow back beautifully. You know, people overpluck or they lose eyebrows over time. But have a medical evaluation, because sometimes hair loss in certain patterns can give us clues to underlying medical conditions. So before you go and try to grow your hair, definitely have a checkup. See your internist, see your dermatologist. Make sure that you know exactly what you're dealing with and what you can do about it. And then you have great choices of products to play with.
And quickly, any cosmetic improvements like extensions, do you think those work?
Extensions are okay. Listen, if you're miserable and you feel like you have horrible hair loss, do what you have to do to look acceptable. Do the minimum in terms of extensions, but do it if you have to. The problem is for women, it's on the crown that they lose their hair, and extensions don't really cover that. It's more hair pieces.
Right.
So that becomes problematic. But I would never tell a woman not to do what she needs to feel beautiful when she goes out.
Right. Oh, well, thank you so much, Dr. Doris Day, for all this great information. And for more health and wellness news, please visit the health page at abcnews.com. And don't forget, you can follow ABC News Now on Facebook and Twitter. Just search ABC News Now.